So, other agents that we can use in the treatment of anxiety, in particular, so we talked about antidepressants, benzodiazepines. Now, there are some kind of one-off agents that I want to spend a little bit of time talking about in this video. One of them being Buspirone or Buspar. So Buspar is sometimes used in major depressive disorder, but its biggest place in therapy is as either a monotherapy or an augmenting add-on therapy for generalized anxiety disorder. It doesn't have a lot of notable benefit for people who have other types of anxiety or related disorders. So not a lot of data to support its use, say, in OCD, panic, or PTSD. The one challenge that we see with it is it's oftentimes dosed 2 or more times per day, and individuals are sometimes prescribed it as needed, but the data to support its benefit and as needed use really isn't notable. So 2 to 4 weeks, it does work a little bit faster than what we often see with antidepressants, but it still needs to be in general taken every single day. We don't fully understand how Buspirone or Buspar works. It has some serotonin activity, so it has some partial agonistic activity at our 5-HT1. It also has some dopamine-related activity connected with it too. Fairly well tolerated. Biggest things that we'll see: dizziness, nausea, some headaches. Notably, too, people tend to be a bit more likely to develop restlessness or akathisia with this, probably due to some of its activity with serotonin and dopamine in combination. Atarax, Vistaril, also known as Hydroxyzine, is a medication that is an antihistamine by nature, but works fairly well inside of the brain, so it can get into the brain. A lot of our newer antihistamines don't have that penetration into the brain. Benadryl does, but has such significant anticholinergic effects, and likely that risk versus benefit for anxiety is not as well demonstrated. This tends to be a second line option for generalized anxiety. It can have acute effects, so short term effects, which can be beneficial, which also means that the medication can be used scheduled or as needed and can work much faster than, say, a traditional antidepressant. That's a benefit. We'll sometimes use this kind of as a replacement or as an alternative for benzodiazepines for people who may prefer not to use benzodiazepines or have risk factors for using benzodiazepines. And the dose is fairly flexible, so we can use up to 300-400 milligrams of the medication per day, but a lot of people might use 25 or 50 milligrams 1 to 3-4 times per day. So it does cause some sedation. A lot of people will develop tolerance to the sedation over time because it's related to the antihistamine effect, and it is drying. So it does have some of that anticholinergic side effect profile that we will see with these types of medications. So the SLUT, right? Salivation dries up, lacrimation, your eyes become dry. You can have a little bit of urinary retention, constipation. So there are some side effects connected with it. We will also sometimes see what we call QT interval prolongation, which is part of your heart rhythm, your heart electrophysiology. We can see some changes with that too, which as a pharmacist, we may monitor for, but just being aware that there are some potential risks with this medication. Another medication that has some use in the anxiety world is Propranolol or Inderal. So this is historically an antihypertensive or a blood pressure medication. This is a beta blocker, so it blocks beta receptors in the heart. And when we block beta receptors in the heart, this will actually decrease someone's heart rate and subsequently decrease their blood pressure. So this feeds back into your body and your brain are connected and kind of inform each other scenario. So one of the big spaces for propranolol is for event-related or performance anxiety. So the physical feeling of anxiety gets suppressed, which can help with the mental feeling of anxiety. Now, if someone already has lower blood pressure, then this can drop their blood pressure more than would be helpful for them. So oftentimes what I suggest is people try a dose of propranolol before that big event, just in case, because they don't want to be passing out while they're presenting a big, a big project or something like that. People may experience some fatigue, so some feeling kind of worn out, and feel some coldness in their extremities due to their blood not perfusing as well as it should. But overall, pretty well tolerated medication. Doesn't have that risk of misuse that we see with benzodiazepines. We will sometimes use it in standard anxiety, like generalized anxiety, but certainly has a good role potentially in event-related anxiety. Prazosin or minipress is an interesting product that is also historically an antihypertensive, so a blood pressure medication, and it's an alpha-1 blocker. So how this is proposed to work in PTSD or post-traumatic stress disorder is most of the data is targeted for nighttime disturbances, particularly nightmares. So blocking the sort of norepinephrine activity in the brain through these alpha-1 adrenergic receptor blockade actually can decrease the activation in the brain that can happen during basically a disruption in REM sleep, where we tend to be more likely to experience those dreams, whether they're good or not good. So it reduces the fear response, can improve sleep quality. The data is not awesome, honestly, with Prazosin. And some people will also prescribe it for daytime symptoms. Some people do have some benefit there too. But really the most amount of data is through nighttime symptoms. It's usually not used alone. Should be used in combination with other types of treatments because it's really not going to, in general, do a great job targeting any other types of symptoms. But if someone is adequately treated with other interventions for their PTSD, but still having significant nighttime disturbances, this could be a potentially good option. Because it's a blood pressure medicine, just like with propranolol, we do see the potential for a lowering of blood pressure, some drowsiness, dizziness. And this is most notably directly after the first dose or in a significant increase. So we always instruct people to get up slowly from laying down because they'll take it at bedtime, swing their feet over to the floor and sit for a moment upright before they try to get up to try to reduce any risk of fainting or falls or anything like that. There's one more medication that I did want to mention that's a newer product, but it's really a recycling of some old products that work well together. So this is Auvelity, which is also referred to as dextromethorphan, hydrobromide plus bupropion. And bupropion is a traditional antidepressant. It's our NDRI antidepressant, but it's actually working in conjunction or in synergy with the dextromethorphan to boost the DXM. So by boosting the DXM, it stays in the system longer and can have antidepressant activity. So our primary antidepressant here is actually the dextromethorphan. So the dextromethorphan is an NMDA antagonist. It also affects sigma-1 receptors. So it's a sigma-1 receptor agonist. And this appears to potentially enhance glutamate, which is associated with faster onset of depression treatment or antidepressant activity, but doesn't tend to last as long either. So we see that with ketamine, for example. So it works together to treat depression. You can have some benefits there. As you can see too, it tends to work a bit faster than bupropion alone. This is 105 BID. That's not a terribly low dose. A lot of times people will go somewhere between 150 and 450. Most people settle about 300 milligrams of bupropion a day. So it's not a terribly low dose, but we do see that separation in benefit in the MADRS score, which is a depression scale, within a week, right? So it does seem to work maybe better, faster than bupropion alone. We do have to take into consideration the same concerns with bupropion, so things like seizure risk, alcohol use disorder, benzodiazepine use disorder, and eating disorders. Yep. So to review some algorithms, we're going to do that in the next video. Hopefully that was helpful to go through some of those medications.